She's a fashion blogger, model, and entrepreneur.
She's amazing.
The latest tips on fashion, beauty, wellness, travel, and her lifestyle. And now, here's the founder and creator of NotBasicBlonde, Olasha.
Hi, Dr. Sara. So glad to have you on my podcast. How are you today?
Good. Thank you so much for having me.
Yeah, thank you so much for being my guest and you having such an amazing expertise in field that not many people are talk about always. It's very interesting to hear your opinion on so many questions that I have.
Okay. I really love the opportunity to talk about this because I think that so many individuals and women in particular experience pelvic floor issues, yet we don't really know that because we don't talk about them so openly, but I hear about them all day and working with my patients. So I think it's just really wonderful to be able to share that these issues are more common than we realize and there is help for them. So I'm really excited to be here today.
Thank you. And we would love to learn more about you, your career, and how did you get in your career?
Well, my name is Sara Reardon. I am a doctor of physical therapy. I went to Washington University in St. Louis for undergraduate and then physical therapy school. And when I graduated in 2007, I started doing pelvic floor therapy right away. And it wasn't a very known or common field, but it just really working with men and women because all individuals have pelvic floors with urinary leakage, painful intercourse, pooping issues, peeing issues. And then I have two children who are 5 and 7. And when I was pregnant, I realized how much our body and our pelvic floors transform and how much support we need during that process. So I really started diving much more into pregnancy and postpartum recovery and working more in that space to help support moms. So I have two children and I live in New Orleans where I have a small clinic where I see patients. And then I have an online presence on Instagram and my website as The Vagina Whisperer.
How did you come up with a funny name?
So I wish that I could take credit for creating the name The Vagina Whisperer, but it's really something my friends from college gave to me. We were getting together during the summer times when I was in after graduate school working in this field. And, back then it was like, wait, you do what? How is that physical therapy? And then I would tell them, the types of things that I help with. And they were like, you're like the Vagina Whisperer. And so they really came up with the name. And when I started my Instagram account, it was for my group of friends because we were all having babies and going through postpartum. So that's how I came up with the name and how I got the name The Vagina Whisperer.
I love it. And I've had personal experience with pelvic floor PT because I've been in sports all my life and I've been in gymnastics, I've been in yoga and fitness. And then I had issues like I was feeling that my bladder I had a feeling that it wasn't empty, but it was. So when I went to doctor, they done all the possible checks and they were like, nothing is wrong with you, but why do you have this feeling? And then they recommended me to go to PT, like pelvic floor PT. And when I went there, they found out that my pelvic floor muscles were too tense because of stress, I guess, or like everything that was going on. And that's why I was having those issues. But who would knew that just the muscle being so tense can give you such problems.
Absolutely. I think that's so amazing of you to share your story because we realize that so many individuals have these common issues. And you touched on something that I think is really important when we talk about the pelvic floor is that, as women growing up, we were often told like, do your kegels and strengthen your pelvic floor. But we don't talk about the flip side that some pelvic floor muscles some people have pelvic floor issues because their muscles are too tense, and doing kegels or strengthening exercises can actually make it worse. And so like any other muscle in your body, it can be weak and need strengthening, or it can be too tense. And I kind of compare this like I get headaches a lot because my neck muscles and my shoulder muscles get tight and tense and I need to learn to relax them or get massage. The same thing can happen to your pelvic floor. It can be too tense or overactive and lead to bladder issues or pain or pooping issues.
What is a pelvic floor muscles assessment? What are the signs of pelvic floor muscles needing some tuning?
When we talk about the pelvic floor, I like to describe it like it's a basket of muscles or a hammock of muscles at the very bottom of our pelvis. So we all are kind of familiar with, our pelvic bones, and they kind of form a ring at the bottom of our, at the base of our skeleton. So think about those bones, pelvic bones, having a basket at the very bottom. So that basket of muscles slings from the pubic bone in the front to the tailbone in the back and side to side. And those muscles help support your pelvic organs, which include your reproductive organs. So your uterus, your ovaries, also your bladder and your rectum. In males, it will contain the prostate as well. And then those muscles have sphincters. So the urinary sphincter and the anal sphincter, which help keep in pee and poop throughout the day. And then when we go to the restroom, we can relax those muscles to empty. And then in a female body, it also has the vaginal opening for vaginal intercourse, menstruation, vaginal birth. So really important roles that this muscle plays, yet we don't really talk about them. So if you are having issues with, urinary function, bowel or pooping function, if you're having painful intercourse or any sort of pain, or even just going through life changes and transitions like pregnancy, postpartum, menopause, menstruation, those are all times that these muscles really have an important role.
It's like no one really even talks about this, but so many issues are actually underlined, and so many issues are people can have because of this pelvic floor muscles. And while the new mom's health concerns are always brushed under welcome to motherhood slogan, and how can we fix this?
Right. So, one of the things you just touched on it, we don't really talk about this because these are really intimate parts of our body. They're not things that we talk about day to day with even our partners, our friends, or even sometimes our medical providers. And if we do want to talk about them, we often don't know where to go. So, one of the first things is it's important for us to talk about them. These are things we do day to day in our lives: peeing, pooping, sexual health, pregnancy, menstruation. I mean, we all, as a female body owner or a female, may experience some changes in this part of our body. So when it comes specifically to motherhood, it's unfortunate that in the United States specifically, we've gotten to this point where it feels like the mom's role is just to have the baby. And then once the baby is here, there's not a lot of support or care or concern for the mom. And, we can see that even during pregnancy, we have weekly check-ins with our medical provider, once a month and twice a month, and then weekly. And then after the baby's born, the baby has the weekly and monthly checkups, but the mom has maybe one postpartum checkup, and 40% of individuals don't even attend that postpartum checkup. So the system just isn't set up to really give us the guidance and support that we need. Also, I think that, we have a work culture where we don't have paid maternity leave. So moms are going back to work and they're still physically recovering from these issues, and they're struggling with pain or lactation, mental health issues. And then also, I think that we as moms, you kind of have to be superwoman these days. You have to just, wake up every day and do the things you need to do to take care of your baby, to keep them healthy, but often our health gets put on the back burner. So I think there's a lot of things that just in the medical system and just in our social structure aren't out there for moms to address this issue specifically. So we just kind of think we have to deal with it.
So true. Even in other countries, they give you, in Russia and Ukraine, they give you like 2-3 years of maternity leave, and Europe and other countries. And here you only get like 2-3 weeks and you have to go back to work. And it's the worst for you moms. Like, I'm not a mom yet, but I know like what my friends went through, and it's hard.
It's very hard. It is very hard. And so I think, we've even seen in other countries that they not only do they get paid maternity leave, and but they also get physical therapy prescribed as just part of the postpartum healing process. So it's automatic that every, person who gives birth automatically gets referred to pelvic floor therapy, because we know that their bodies need rehabilitation, and we don't have that system in place here. So it's something I would love to see happen, that it becomes the standard of care, and not just postpartum, even during pregnancy or menopause, or when we become sexually active, any of those times and transitions in our life, this type of therapy can play a really integral role.
Yeah, totally agree. And what do you think what causes the pelvic floor muscles to be tense or the opposite?
Right. So, like I said earlier, our muscles tend to go in one or two directions in our body. So there can be weakness. So typically weakness of these muscles means that they're not supporting your pelvic organs as well, which can lead you to feel like there's pressure or heaviness in your pelvis. It can mean you have a hard time holding in pee or poop. So you may leak with coughing or sneezing or rushing to the bathroom, or have a hard time holding in gas, or leakage during exercise. And so typically the weakness happens with pressure. So it can be from chronic straining, from heavy lifting, from high impact exercise like jumping, cheerleading, running, things like that. Also, pregnancy. Pregnancy itself, if we think of this muscle like a hammock, that hammock goes from holding, something the size of a blueberry or an avocado to something the size of a pumpkin or a watermelon. So that muscle gets strained and lengthened and weakened just through the course of pregnancy. And then if we think about, and then hormones also play a role. Lower estrogen levels with breastfeeding or lower estrogen levels during menopause can also lead to weakness. On the flip side, tension can be from a lot of things. Like I said, I have tension in my neck and my shoulders, and I get migraine headaches. You can have tension from the way that you sit, from just the area in your body where you hold tension. We call them butt grippers, and you can kind of see them. They like squeeze their cheeks together a lot. And, I find myself doing that when I'm waiting in the carpool line or in traffic to pick up my kids, or I'm watching a scary movie. Our bodies just hold tension in certain regions. And also, the way that we work out. If we look at Pilates or our bar exercises or all of this fitness stuff, it's told us to like tighten our pelvic floors and suck in our cores. And that's all focused on tightening. But we need to balance those muscles. It's not just about contracting, it's also about relaxing. So, and then stress, which we've all had for the past several years living through a global pandemic. So all of these things can also lead to tension, which can lead to, again, pain or bladder or bowel issues over time.
I see. And when I was going through pelvic floor therapy, the pelvic floor PT, when I came there, they did kind of assessment, like they had to, they connect a little monitor where in certain areas they would attach it, and then they would actually see the muscles and the weakness of muscles and strengths of muscles. And after they showed me some kind of device. It would look so weird, and they told me they would have to like go in and actually, to stretch out those muscles and to kind of relax them. But also they recommended me to do a lot of stretching. So I guess stretching helps a lot. Yoga and Pilates should do that too as well, right?
Right. So, we think about this if you have weak muscles, we're going to kind of address the issue a certain way. And if you have tense or tight muscles, we're going to address it a certain way. So it might be helpful to start by thinking about like, what is pelvic floor therapy and what someone can expect in the session, because that can feel a little bit scary or overwhelming. So when you go see a pelvic floor therapist, it's one-on-one. So you'll meet with an individual, a therapist in a private room. It's not in a big gym type setting. And they'll ask you lots of questions, not just about the issues you're experiencing. So in your situation, that may have been bladder issues, but we'll ask about sexual health, bladder function, pregnancy, birth, medication, stress, exercise, all of the things to get a really clear picture as to what could be contributing to the issues you're having and how we want to address those. Next, we'll do a pelvic floor muscle exam. And it's similar to almost a gynecological exam where you'll be, undressed from the waist down, and then we'll observe the pelvic floor muscles looking at the vaginal opening. We'll ask you to squeeze like you're doing a kegel, and then push or bear down like you're having a bowel movement or having a baby. We'll press on the outside of the muscles with a gloved finger to see if there's tension. And then we'll insert a gloved lubricated finger into the vaginal opening. And it's through the vagina we can assess those muscles. So, we think of kegels like vagina contractions, and that's because the vagina is part of that muscle. So the way we assess the muscle is through a vaginal exam. And then we press on the muscle for tension, and then we test the strength of the muscle as well. So that lets us know, is the muscle weak? Is it too tense? And then that gives us an option for treatment.
Very interesting. And how do you recommend for someone, do you recommend doing them for like pregnant women or postpartum, or when do you recommend to do physical floor PT?
Right.
I mean, pelvic floor PT.
Pelvic floor PT, all of it. Pelvic floor PT, pelvic floor physical therapy, all the same thing. So one, if you're having an issue. So again, if you are having something that doesn't feel right to you, when it comes to bladder health, are you peeing really frequently? Are you having a hard time starting your urinary stream, or feel like you're not emptying your bladder well? Or is urination painful or burning? Chronic urinary tract infections? Or are you leaking? Are you leaking urine with coughing, sneezing, exercise? That would be a time to go see a pelvic floor therapist. When it comes to pooping, are you straining with bowel movements? Or do you have a hard time holding in gas, or feel like you're leaking, poop throughout the day, or you can't get to the bathroom? If you're having hemorrhoids or fissures, those are all signs to see a pelvic floor PT. When it comes to sexual health, painful intercourse, painful orgasms or difficulty having an orgasm, and even when it comes to difficulty having pelvic exams at the doctor, difficulty inserting a tampon, those are all signs that the pelvic floor muscles aren't kind of functioning the way that we want to. And then obviously I would recommend that every person go see a pelvic floor therapist during pregnancy, even if you're not having problems. In our clinic, we see women who are pregnant all throughout their pregnancy, but definitely in the third trimester, because we teach them how to give birth. We go over different positions to push when they're giving birth, how to breathe when they're giving birth, different exercises to relax the pelvic floor muscles, during the labor and birthing process. We're always kind of thinking we need to have really strong, tight pelvic floor muscles, during pregnancy, and then we need to push the baby out really hard with those muscles. Actually, it's the opposite. You do want strong pelvic floor muscles during pregnancy, but when it comes to birth, we want those muscles to relax. And that's really where yoga and breathing and softening the muscles can be helpful. So we teach people how to, do stretches and breathe so that their muscles can just kind of get out of the way during birth. And the uterus really pushes the baby out versus your pelvic floor muscles doing it. And then postpartum. If you've had a baby, whether it was 6 weeks ago, 6 months ago, or 6 years ago, check in with the pelvic floor PT. It's never too late. If you're having issues, or you just want to be proactive of, hey, I'm thinking about having another baby, or I want to train for a marathon, or, I'm starting to have a couple issues, with my bladder, check in and see, are there things that you could be working on? I always say it's like we go to the dentist twice a year to check on our teeth. I'm not sure why we're not going to a pelvic floor therapist once a year to check on our pelvic floor.
So true, because women's health is very important, and sometimes we don't even pay attention enough to it. So, and then we start having the problems, and then we start going to doctors.
Right. And so, we right now, with my focus really on pregnancy and postpartum, I see women even before they conceive, working on, anything they need to work on, definitely during pregnancy, and definitely postpartum. As early as 6 weeks postpartum, we can start to see them. If you've had a cesarean birth, definitely you will still want to check in with one. If you've had perineal tearing or an episiotomy, you want to check in with one. And if you go back to sex or exercise and things just don't feel right, definitely check in with one as well. So, but I think everybody should have one during pregnancy and definitely postpartum as well.
How can we take a great care of our pelvic floor muscles? And could you share some tips?
Yeah, this is a great question. And I think it first starts off with not everybody needs to do kegels. So, we touched on this earlier that if you do have weakness, you may need to do some strengthening. But again, you may have tension and you may need to do more relaxation work, which would include, as you mentioned, yoga, breathing, stretching. Sometimes we even do what's called internal pelvic floor massage, where we go and release those muscles internally, just like you would release a tight knot in your shoulder. That's what we do internally through the vagina. And then there's something called vaginal dilators that look like tampons of different sizes, which help you relax the pelvic floor muscles. So again, it really just depends on where your muscles are, and a pelvic floor physical therapist can evaluate that, and then give you some guidance on what the best next steps for you would be. Now, when it comes to tips to prevent issues, or just things that we all need to know, really the basics, that how do we pee? So I tell people this all the time. Sit when you pee, try not to hover over the toilet, because if you hover, Your muscles may stay tense and you may not empty completely. So make sure that you're sitting when you pee. Make sure that you're not pushing when you pee. When you sit down to pee, you want your muscles to relax. So just sit down, take some big deep breaths, and your bladder is a muscle that actually pushes the urine out for you, so you don't have to push. I know as busy moms or working women, we want to make everything go through as fast as possible and kind of can rush through the bathroom, but just sit and chill and breathe and let your bladder do the work for you. So don't push when you pee. And then if you are, a high intensity exerciser, or if you are a runner, or, I would really kind of think about, what am I asking my pelvic floor to do? And I probably should check in with someone. So you need these muscles to be strong. We need to train our pelvic floor muscles just like we need to train our biceps. So check in with something if you do have a job where you're lifting a lot, or you're going through a time in your life that's transformative, like pregnancy, postpartum, menopause, and check in with a PT. When it comes to pooping, I tell everybody to get a little stool that goes under their feet to help with pooping. What that little step stool does is when you put your feet on it when you're pooping, it helps relax your pelvic floor muscles. And we want our muscles to be relaxed when we're pooping, just like we want them to be relaxed when we are peeing or giving birth. So they're called squatty potties, or just a little toddler stool, or yoga blocks even. You put it under your feet when you are pooping, and it puts your body in more of a squatting position. And then when you're pooping, you push out a little bit. So you do want to push when you're pooping, but you exhale. So don't hold your breath. I always say blow out like you're blowing out a bunch of birthday candles, and that helps you prevent from holding your breath. So learning how to pee, learning how to poop, and then, knowing when to get help. Pain is not something that's normal. So bladder pain, painful bowel movements, pain with intercourse or tampons, those are all signs that something's not working as optimally as we would want. And I would check in with somebody, because it doesn't typically just go away by itself. There are people who get more physical therapy for a broken pinky than they do for a major pelvic floor issue, or, abdominal surgery from a C-section, or painful sex. So, really be proactive in taking care of something that doesn't feel right, and seek out pelvic floor therapy for help.
I see. And I've had one of the questions some people ask me to ask you. So is being sexually active or inactive, does put any impact on pelvic floor muscles?
Yeah. So in order to have kind of comfortable, enjoyable sexual intercourse through the vagina, so if you're going to have vaginal intercourse, you want it to be comfortable. So your muscles need to be relaxed. You need to have adequate lubrication. Your kind of vaginal lubrication levels can change depending on the time of your menstrual cycle, or if you are having hormonal changes. So if you're taking birth control, if you're breastfeeding or lactating, if you're going through menopause, those may be times where you have less vaginal lubrication and you want to supplement with a lubricant. But when you do have vaginal intercourse, you get really good blood flow to your muscles. And these are muscles like any other muscle in your body. You want to use them. And, you want to kind of have that very, something's pretty consistent if possible to help, keep this area of your body healthy and engaged. And it also, sexual intercourse can release oxytocin, which is a feel-good hormone for us. So there's definitely benefits to it. However, if it's painful, I would not just tolerate it or try to push through. That's when I would really say, sex shouldn't be just tolerable. It should really be enjoyable. And so that's when I would kind of seek to get help. Now, if you aren't regularly sexually active, I wouldn't worry about it too much. But if you're avoiding intercourse because of pain, that's when I would start to say, yes, it is probably a healthier track to get the issue addressed and see what could be causing it. It could be vaginal dryness. It could be tight, tense muscles, either at the opening or deeper. It could be scar tissue if you've had an episiotomy or a perineal tear during birth. Those are all, different things that can lead to pain, which may inhibit someone from being sexually active. So I think it's, eating, sleeping, drinking water, peeing, pooping, sex. I really feel like those are kind of foundational things that we want in our life, but the frequency of that varies for everyone. But again, it should be enjoyable and pleasurable when you are having sexual activity.
Those are great tips. And what inspired you to be physical therapist in this area?
I wish I had this amazing story that I had this problem, but I really, I think when I was in graduate school and thinking about what I wanted to do, I thought I was going to be a trainer for the New Orleans Saints football team or for athletes, because I used to be a pretty big runner. And I really found that understanding my own body as a woman was really interesting to me. And I thought, oh my gosh, nobody tells us how this part of our body works. We kind of go, even in physical therapy school, we get down to the hips. And if you have hip pain, and then we go down to the knees, but nobody talks about this pelvic region. And it has such important functions in our day to day. So I think as a woman, I was really attracted to understanding my own body. And then when I started working with patients, I found that there are so many people who have these issues who don't even realize there's help. So it's just an incredibly rewarding field. I love what I do. I love being able to help people with something that really can change their quality of life, can impact them. Like if they weren't able to have sex, they wouldn't be able to get pregnant. And now they have growing families, or, painful intercourse was affecting their relationship. And now, that's no longer an issue. Or, running is really important to someone and they weren't doing it because they were leaking. So now they're able to do something they enjoy and is good for them physically and mentally. So, these are really intimate issues. I'm really comfortable talking about them. That helps too. Talking about pee and poop and sex is just dinner table conversation for me. But I think really being able to help people with something that's so personal, but also really important, has just been the best part of this job over the past 15 years.
That's incredible. And I know many people don't even talk about this topic, and they don't even know about pelvic floor therapy, PT, and they're prescribed so many different prescriptions, medicine, and it all can be fixed with just simple PT like we do for other parts of our body. I'm so glad you covered this today. And where can our listeners find you? Your social handles, all your information?
Thank you. So, well, thank you for having me. I think it's so wonderful to be able to share this with your community, and it just affects so many people, and there is definitely help for it. I am on Instagram. So my handle on Instagram is The Vagina Whisperer. It's the Whisperer. And I sometimes make an appearance in a vulva suit. So check out that. I am on TikTok at The Vag Whisperer, because TikTok does not like the word vagina. But then I also have a website, thevaginawhisperer.com. On that website, I have tons of fitness programs. So if you do need strengthening during pregnancy, during postpartum, I really walk you week by week through pregnancy and postpartum pelvic floor training and postpartum recovery. And then I'm also launching a painful sex series next month to really help people like yourself, or someone who has tense or tight pelvic floor muscles, how to relax and down train those muscles. Because again, it's not just Kegel exercises.
Thank you so much for being my guest.
Thank you for having me.